As the country continues to grapple with the effects of the COVID-19 pandemic, one of the major causes of concern has been the cost of managing and treating the disease. The cost of treating COVID-19 has pushed many to financial distress, as it can go as high as 1 million shillings in the case of admission to the intensive care unit. Treating COVID-19 symptoms will depend on the severity of the symptoms and may cost as little as 500 shillings for a prescribed painkiller to as high as 200,000 shillings for a clinical drug like tocilizumab, or 41,000 shillings per vial for the FDA-approved COVID-19 remdesivir. Other drugs used are mouth gargles, steroids, blood thinners, and blood pressure stabilizers.
The levels of hospitalization are largely determined by the severity of the disease. So, by and large, we have about 4 categories of patients.
The first category of patients is asymptomatic, which means that they don't have any symptoms of the illness but test positive for COVID. The second category have mild to moderate symptoms, meaning they have slight side effects like a low-grade fever or muscle aches. According to the Ministry of Health, it costs approximately 2,000 shillings per day to treat asymptomatic patients and those with mild COVID symptoms under home-based care. For treatment at an isolation center or hospital, it will cost an asymptomatic patient or one with mild symptoms an average of 6,700 shillings per day. This will cater for accommodation and overheads. The third category of patients are those with severe symptoms, meaning they have difficulty breathing with oxygen levels below 90. The fourth category are those with critical illness who require admission in the intensive care unit.
For these ones, they require oxygen since they are critical and unable to reach optimal levels of oxygen in their blood. So they require supplemental oxygen. Usually they're given high flows of oxygen. Okay, and then they're put on blood thinners to reduce the rate of formation of blood clots.
On the other hand, it cost 13,137 shillings to manage patients with severe COVID-19 symptoms in general hospital wards and 63,243 shillings for those with critical COVID-19 symptoms admitted in intensive care per day. Apart from the cost of treatment, hospitals require an admission fee, which is usually taken as a deposit. Admission at the Aga Khan University Hospital cost 300,000 shillings for the general ward and 1 million shillings for the HDU or ICU. At Nairobi Hospital, you will have to fork out 100,000 shillings to be admitted at the general ward and 150,000 shillings for a private room. Avenue Hospital charge 100,000 shillings for the general ward and 250,000 shillings for HDU. Patients who check into Karen Hospital need 300,000 shillings to be admitted in the general ward, while those that need critical care are charged 500,000 shillings. At the Mater Hospital, admission fees in the general ward cost 100,000 shillings, while HDU and ICU cost 600,000 shillings. Nairobi West Hospital charges 200,000 shillings for the general ward and 300,000 shillings for HDU.